Okay, may I ask you to have your spine upright, having your, yeah, perfect. Great, that's perfect. Okay, so that's 92, and now inhale. Okay, perfect, that's 97. Okay, so that's 92, and now inhale. Okay, perfect, that's 97. Hello, Mr. Lars.
Hello.
My name is Dr. Kevas, and I will be doing an inspection of you today. So what we are going to focus on today is a pulmonary inspection, then also abdominal inspection, as well as cardiovascular inspection. So this will involve you having to take off your shirt later. Is that alright with you?
Yeah.
Perfect. So first of all, I'm just going to do a general inspection, which means I'm going to just inspect your breathing. Perfect. That seems normal. I want to ask, do you have any troubles with breathing? Do you have asthma or anything like that?
No.
Okay. Do you cough, or are you having cold lately?
No.
Okay. Perfect. So what we are going to do now, I'm going to look for any cyanosis. Okay. Could you please have your hands like this? Turn them around. Perfect. Could you open your mouth? Stick out your tongue. And then put it up on your palate. Perfect. Great. You can close your mouth now. Perfect. That's great. Okay. Perfect. So now I'm actually going to ask you to take off your t-shirt, if you might.
Okay.
Okay, so I'm going to look at the medial lateral directions of the chest. Also, as well, the anterior posterior dimensions of the chest. Okay, may I ask you to have your spine upright, having your, yeah, perfect. Great, that's perfect. So I'm looking for barrel chest. There is nothing here. Your posture seems absolutely normal. That's great. So what I'm going to do now, I'm actually going to palpate the area of your lungs and respiratory system. Is that all right?
Yeah.
Perfect. So I'm going to touch you, and we are just going to palpate. You will tell me if you feel any kind of tenderness, pain, anything that is uncomfortable.
Okay.
Okay, also here at the lateral side. Anything uncomfortable?
No.
Perfect. Here?
Everything okay.
Okay, perfect. I'm also going to palpate the clavicles, or around the clavicles. Perfect. Also, we are going to go up your neck. We are going to palpate the lymph nodes. That's perfect. Now here. And here. Any pain, any tenderness?
No.
That's great. Lymph nodes. So now we are going to palpate, looking for any reproducible tenderness. So I'm going to palpate again the areas of your lung fields.
Okay.
That seems fine. I will actually ask you to turn around and I will also look at your back. Just going to try that everything is good. Okay, so I'm going to again first start with the palpating of the lung fields, okay? You will tell me if you feel any tenderness or pain. Everything good?
Yeah, everything good.
Okay, perfect. So now what we are actually going to try is that you are going to have your arms crossed on your chest.
Yeah.
Perfect. And I will take my measure tape. We will going to look at the lung expansion. We are at the 10th rib approximately. And I will ask you to actually exhale fully. Okay, so that's 92, and now inhale. Okay, perfect, that's 97. Okay, so the lung expansion is fine. It's from 92 to 97 centimeters. That's great. I'm actually going to put my thumbs here. I'm going to make a little fold and you will exhale. And now, yeah, perfect. And now inhale. Okay, perfect. Exhale. So it is symmetrical bilaterally. Okay, that's great. Also going to so now I'm going to percuss, okay? I'm going to percuss again the lung fields. We are going to avoid the bone area, which is actually your spine and your scapula, because the sound just would be different. The sound is also different when we are going from up to down, because there is a difference in the ratio of how much blood there is, and also how much air there is in the tissue underneath. Okay, so let's just the sound should be resonant, not a dull. Perfect. I will ask you to have your arms like this, a little bit more in front. Perfect. Now. Perfect. That's great. So now we are actually going to proceed to auscultating your lungs. So I'm just going to ask you now to breathe in with your mouth and exhale as well with your mouth, okay? You will take normal breaths, not excessively deep inhale. A little bit more deeper breaths, please. Perfect. Perfect. Now at your side. That's great. Perfect. Now I'm going to ask you to turn around again, and we are going to oscillate the lung fields again, this time on your anterior chest. So if you could inhale. Perfect, you're doing just fine. Final breath. Perfect. Great. That seems about right. There doesn't seem to be any particular problems. I do not hear any cracking, no whistling, wheezing, nothing like that. Okay, so now we are actually going to proceed to your abdominal inspection. So I'm going to ask you to lay down on your back with your head. Okay. Perfect. That's great. Perfect. So I'm going to go from the other side, and I'm first going to ask you to actually slide down your pants a little bit. Perfect, like this. Great, perfect. You can lay down. I'm going to just look at the abdomen area, looking for any hernias, any masses, any lesions, anything that should not be there. I see nothing here. I'm going to ask you to actually bend your knees a little bit. Okay, and now lift your head for a second. Okay, down. You can extend your legs now. Perfect. So there is no hernia here. Perfect, that's great. So I'm just now going to listen to the abdomen in all four quadrants, okay? We are going to listen to the bubble sound. Okay, positive bowel movement in first quadrant. Positive bowel movement even in the second quadrant. As well as in the third. And fourth. Now I'm listening to the aorta. Perfect. So positive bowel movements in all four quadrants, that's perfect. Now I'm actually going to be percussing the first quadrant here, and I'm going to look for your liver. Okay. So the liver is approximately here. It is usually 6 to 12 centimeters long. Now I'm going to actually percuss this area where your spleen is. Perfect. Now here. Okay, so now what I'm going to do is that I'm going to lightly palpate your abdomen. It might be a little bit uncomfortable, so if you feel any pain, just let me know, okay?
Okay.
So I'm actually trying to palpate the liver, now the spleen, okay, now here, and the pain, okay, so now we are going to actually do deep palpation, which is going to be uncomfortable for sure. I'm going to try to palpate your organs. If you feel any pain, just let me know. I'm going to ask you to inhale and exhale. Okay, now inhale again and exhale. It doesn't even have to be a deep breath in. It's just that I'm going to go down into the tissue when you are exhaling out, okay?
Okay, I get it.
Perfect. Perfect. Great. Okay. Now let's find the spleen. Okay. The spleen is non-palpable. Okay, now we are going to look for your kidneys here and here. Okay. Okay, once more. Perfect. Okay, and now here. That's great. You're doing just fine. Few more breaths. That's great. One last. Perfect. That's great. So this is the abdominal examination. It is done. You can sit down now. There is no problem with your abdomen. You felt no pain, right?
No pain.
Perfect. I'm just going to slide your pins a little bit upward, and you can sit down again. So what we are going to do now is actually your cardiovascular examination, okay, which means I'm going to look at your heart. I'm going to listen to the heartbeat. First I'm going to try to check the pulse on your hand, okay, pressing on the radio nerve. Now I can feel the pulse. Measuring it for 15 seconds. And perfect. Now I'm going to look at your breathing for 15 seconds. Multiply it by 4, as well as the pulse on your hand. Perfect. So now I'm actually going to listen to the hair. I'm going to ask you to inhale in and then hold your breath like this. Perfect. Perfect. Now the other side. Now the other side. That's great. Perfect. So now I'm going to listen. I'm going to listen in this area. Okay. Okay. So let's just start here. Perfect. You can breathe absolutely normally. Your heart is actually very strong. Okay. Do you sometimes struggle with arrhythmia?
Maybe sometime.
Okay. When does it usually happen? When you do any sports or anything like that?
I have it sometimes in the gym.
Okay. Perfect. Now I'm going to ask you to sit here.
Okay.
You will have your, it doesn't matter. Yeah, you can sit even like this as well. I'm going to listen to your heart again, right here. And you're actually going to move on your side like this. Perfect. Perfect, and you can sit down again. That's perfect. Okay, you can put your shirt on again.
Thank you.
And this is the end of the examination for today. There is nothing really serious about your condition. Your respiratory system is absolutely fine, as well as your abdomen. What I'm actually worried about a little bit is your heart. So I really recommend you to go to a doctor to look at it. Okay. In case there might be any problem in the future, okay?
Okay, thank you for checking
Thank
me.
you. Thank you for your time. Bye.
Bye.